We have to look back through history. We can often tell when major diseases happen by just looking at population numbers. Sundry drops usually mean there was a big outbreak, like a plague or a pandemic. These events have changed the course of history many times. Some lead to improvements in hygiene, medicine, and scientists' work, while others cause fear, confusion, and long-term damage. In some cases, people learn how to prevent future outbreaks, but in other situations, diseases spread faster than people could react, and they were left waiting cures that never came.
Diseases can be caused by many different things, but three of the most common causes are viruses, bacteria, and mosquitoes. Viruses, like the one that caused COVID-19, can spread quickly from person to person through the air, touch, or even surfaces. Bacteria are tiny organisms that can live almost anywhere and often cause infections such as strep throat or tuberculosis. While some bacteria are helpful, others can make people very sick. Another major cause of disease is mosquitoes, which carry dangerous viruses and parasites. For example, mosquitoes can spread dengue, malaria, and yellow fever, especially in warm tropical areas. All of these causes show how important it is to protect ourselves with good hygiene, vaccines, and clean environments.
These diseases don't just affect health, they bring many serious consequences as well. One of the most severe is death or serious illnesses, which can deeply affect families and entire communities. Outbreaks can also create fear and isolation, as people avoid contact with others to protect themselves. Economic problems often follow, since many people can't go to work, and businesses may suffer or close. At the same time, people are forced to adapt, leading to changes in habits such as more frequent hand washings, wearing masks, or avoiding crowded places. These consequences show how deeply diseases can impact every part of life.
A recent example is COVID-19 pandemic in 2020, which changed almost every part of daily life. School closed, works moved online, and travel became limited. It also shows how important science, communication, and government actions are during health crises. Another example is dengue fever, which had affected many people in Buenos Aires. It has become more serious in recent years, partially due to the weather and the environment. People have had changed to their habits to stay safe. In Brazil, yellow fever also has a huge impact in the past, leading to big changes in public health. These examples show how much of an effect diseases can have, not just on individuals, but on whole countries and cultures.
At a local level, diseases often disrupt daily life directly in communities. When an outbreak occurs, local hospitals and clinics may become overwhelmed, and access to basic healthcare can be limited. Families may face difficult choices about caring for sick relatives while protecting themselves. Local schools and businesses may close temporarily to reduce spread, affecting education and income. Moreover, community support networks can be strained, but also strong, as neighborhoods came together to help one another. These local impacts are where the first response to a disease often begins.
At the national level, diseases can influence government policy and the economy. National health system may implement widespread vaccination campaigns, public awareness programs, and travel restrictions. Governments often need to allocate a large amount of resources to manage outbreaks, which can affect other areas such as education and infrastructure. Economic challenges arise as workforce productivity decreases and industries like tourism or manufacturing suffer. In some cases, the political response to disease outbreaks can affect public trust and society stability, making effective leadership and clear communication essential.
Globally, diseases highlight the interconnectedness of our world. In today's era of frequent international travel and trade, a disease that starts in one country can quickly spread to many others, becoming a pandemic. Global cooperation is necessary from sharing information, medical supplies, and research, such as developing vaccines and treatments. International organizations like the World Health Organization play a critical role in coordinating efforts and setting guidelines. Diseases also expose inequalities between countries, as wealthier nations may have better access to healthcare resources while poorer countries struggle more to control outbreaks. Understanding these global dynamics is key to preventing and responding to future health crises.
In conclusion, diseases have profoundly influenced human history by affecting health, societies, and economies at local, national, and global levels. While outbreaks often bring fear, illness, and economic disruption, they also act as catalysts of progress, driving improvements in healthcare system, hygiene practices, and government policies. The COVID-19 pandemic clearly showed how rapidly a virus can change daily life worldwide and emphasize the vital role of science, communication, and leadership in managing health crises. Likewise, disasters like dengue and yellow fever highlight how environmental and social factors contribute to the spread of illness, especially in vulnerable regions.
Furthermore, these health challenges reveal just how interconnected the world truly is. A disease that begins in a single community can quickly scale into a national or global emergency, requiring international cooperation for effective prevention, treatment, and control. The interconnectedness also exposes disparities in healthcare access and resources between countries, underscoring the importance of solidarity and support to ensure that no population is left behind.
Ultimately, understanding the complex effects of disease, from local disruption to global health policy changes, is essential for preparing for future outbreaks. By learning from past experiences and investing in science, healthcare infrastructure, and public education, society can build greater resilience. Though diseases often bring hardship and loss, they also offer opportunities for innovation and growth. How we respond to these challenges will shape the health and well-being of generations to come.